Well, Dr. Kirtane, a lot of people don't know they have acid reflux, which might be in fact resulting in a cough or sinusitis. What's the correlation?
Acid reflux is when the acid from the stomach comes into the esophagus. Normally, after you eat, the food is supposed to pass on forwards. There should be no acid coming up. But there are times when the acid does come up. There are conditions where the esophageal sphincter is maybe incompetent, and that happens. And that acid reflux can come as high as your throat. So you can get changes in your voice box, laryngitis, to the extent that you might even get ulceration. So you can get a pricking pain, change in the voice, cough because the larynx is now irritated. It has been shown even to come up higher into the back of the nose. So producing what we call nasopharyngitis. It can lead to problems in the eustachian tube. It has been shown sometimes in children who have a lot of acid reflux that they can even get ear problems because of the acid reflux. So what the acid reflux does again is produces inflammation.
Okay.
And inflammation then allows infection to come in more easily.
Okay.
So we see a lot of throat complaints which are related to acid reflux.
Okay. Vertigo. You said it is a problem that you see amongst your patients. What causes it, and how does one probably try and avoid it or resolve it?
Yeah. Now, first of all, vertigo is not a disease. A lot of people come to me and say, "Oh God, doctor, I've got vertigo. It's like some terminal illness." No, vertigo only is a symptom. And basically, vertigo means you get a sensation of things moving around you when no such movement is actually taking place. And we would tend to divide this into two major groups: peripheral vertigo, which comes from the inner ear, which is your organ of balance. And there is central vertigo, because ultimately the balance organ interacts with the brain to control balance. So you could have changes occurring in the brain which can also produce symptoms of vertigo. Not only that, but there are sort of systemic disorders. If your blood sugar is too low, you may get vertigo. If your blood pressure is too low or too high, you may get vertigo. So there are so many systemic conditions. So investigating a patient of vertigo is really a big task. And what we tend to do is to take a very detailed history which points us in a particular direction, and then go along that track to see, is my guess correct? Is it Meniere's disease or not, where there is a swelling in the inner ear? Or is this a viral infection of the ear? Or there is a very common condition called benign positional vertigo, where the patient says every time he lies down and turns on a side, they spin. Now, this can be corrected, but provided you diagnose it correctly. So that's some of the common causes of peripheral vertigo. Central nervous system, degenerative disease in the brain, or lack of blood supply to the brain can produce symptoms of vertigo. And then I said the systemic disorders.
Okay.
So it's a huge problem that you need to deal with.
But most of the times you see it in the elderly, and it is something that
Not necessarily. We also get people between their 30s, 40s, 50s coming with Meniere's disease, positional vertigo and things like that. The elderly come, they are more likely to be the central type with poor blood circulation or degenerative diseases. But vertigo can occur even in children.
Thank you for watching CNBC TV 18. For all the market action and news, follow us on our social media platforms.